This is Dr. Satyavani Rongali, Consultant Obstetrician and Gynecology in Cloudnine, Varthur branch, Bangalore. A bulky fibroid uterus refers to an unlashed uterus due to presence of uterine fibroids, which are non-cancerous growths in the wall of the uterus. Uterine fibroids, also known as leiomyomas or myomas, are common, especially in women of reproductive age group. Causes: several factors can cause fibroids. Hormonal factors: estrogens and progesterones are female hormones that are thought to cause fibroids to grow. Genetic factors: women with a family history of fibroids are more likely to develop fibroids. Certain genetic mutations in the cells of the uterus may also attribute to fibroids. Lifestyle factors like obesity, a diet high in red meat and low in fruits and vegetables, stress may increase the risk of fibroids. Age and ethnicity: fibroids are more common in women between ages 30 to 50 years and more prevalent in black women. Symptoms vary depending on the size, location and number of fibroids. Some women may have no symptoms while others experience significant discomfort. Common symptoms include menstrual symptoms like heavy menstrual bleeding called menorrhagia, prolonged menstrual periods, dysmenorrhea which is painful menstruation, pelvic pain and pressure, lower abdomen or pelvic pain, urinary and bowel symptoms, frequent urination or difficulty in emptying the bladder due to pressure on the bladder, constipation or difficulty with bowel movement if the fibroids press against the rectum, infertility or pregnancy complications. Fibroids can cause infertility or causes complications in pregnancy such as preterm labor or delivery. Back pain or leg pain is associated with large fibroids which can press on nerves which can cause back pain or leg pain. Treatment depends on severity of symptoms, the size and location of fibroids, age and whether the woman wishes to preserve fertility. Medical management: hormonal treatments, birth control pills, hormonal intrauterine devices or gonadotropin agonists can help reduce bleeding and pain and sometimes shrinks fibroids temporarily. Tranexamic acid, a non-hormonal medication, reduces heavy bleeding during menstruation. Non-steroidal anti-inflammatory drugs like ibuprofen, naproxen reduces pain and bleeding. GnRH agonists causes temporary menopausal state and shrinks fibroids and reduces bleeding. These are used short term due to side effects. Minimal invasive procedures like uterine artery embolization blocks blood supply to fibroids, causing them to shrink. Myolysis, done by using radiofrequency ablation or MRI guided focused ultrasound, which shrinks fibroids by destroying fibroid tissue with heat or sound waves. Endometrial ablation. This procedure destroys the lining of the uterus, reducing heavy bleeding, but it does not remove fibroids and it is not recommended for women who wanted to maintain fertility. Surgical options: myomectomy, surgical removal of fibroids while preserving the uterus, often preferred for women who wish to have children. Myomectomy can be preferred via laparoscopy, hysteroscopy or open surgery depending on the size and location of fibroids. Hysterectomy, complete removal of uterus, is considered in women with severe symptoms who do not wish to have any more children. Hysterectomy can be done through various methods: abdominal, vaginal or laparoscopic. Less invasive techniques like uterine artery embolization or hormonal therapy may require short recovery time. Surgery, especially abdominal hysterectomy, can require weeks for full recovery. Regular follow-up may be necessary to monitor for fibroid recurrence, especially with non-surgical treatments.